Why is lung cancer surgery emotionally difficult for patients? Imagine facing a diagnosis that suddenly turns your world upside down. Lung cancer surgery is a major medical event that can stir up intense feelings long before the operation even begins. When patients hear they need surgery like a wedge resection, it can trigger shock, fear, and sadness. Many find it hard to accept that they have cancer, sometimes avoiding using the word altogether because of how heavy it feels. Deciding to go ahead with surgery makes these emotions even stronger, as patients confront their own mortality and the seriousness of their condition. Leading up to surgery, patients often experience significant psychological distress. This isn't just feeling nervous. It can include symptoms like fatigue, trouble sleeping, and increased pain. Such emotional strain can make physical symptoms worse and lower their overall sense of well-being. Studies show that patients who feel anxious or depressed before surgery tend to have more symptoms afterward and often continue to struggle with these feelings even a year later. This ongoing distress can make recovery more challenging and affect their quality of life. The emotional burden comes from many directions. Patients are not only dealing with the fear of cancer and the physical discomforts like fatigue and nausea, but also face social and financial pressures. The cost of treatment can be overwhelming, and many worry about how their illness will change their ability to work or care for loved ones. These combined factors create a complex emotional landscape, making the experience feel even more overwhelming. Fear is a constant companion during this process. Patients worry about whether the surgery will succeed, if the cancer will come back, or how their life will change after the operation. This uncertainty can be so intense that it affects their ability to process information and make decisions about their care. The fear of recurrence and the unknown future can weigh heavily on their minds, adding to the emotional difficulty. This emotional strain doesn't just affect mental health, it impacts overall quality of life. Depression can develop or worsen after surgery, leading to feelings of sadness, hopelessness, and low self-worth. When patients feel depressed, they might withdraw from loved ones or hesitate to ask for help, which can deepen their sense of loneliness. This cycle of distress can make it harder for them to accept support and can slow down their recovery process. Many patients also face a loss of identity. A lung cancer diagnosis and surgery can disrupt their sense of who they are. They may question how they fit into their social roles or worry about losing their independence. This identity shift can be emotionally taxing as they try to redefine themselves beyond their illness. Stigma adds another layer of difficulty. Lung cancer is often associated with smoking, and this can lead to feelings of shame or guilt. Patients might feel misunderstood or judged, which can cause them to hide their fears and struggles. This silence can increase feelings of isolation, making it even harder to find emotional support. The emotional challenges don't end once the surgery is over. Long-term, patients may continue to wrestle with accepting their new reality as cancer survivors. Some find renewed hope and strength, but others may face ongoing distress that can develop into depression or other mental health issues. These emotional effects can influence their overall well-being and their ability to stay engaged in treatment and recovery. Supporting mental health from the start is crucial. Research shows that addressing emotional needs can help patients live longer and feel better. Treating depression and anxiety can reduce physical symptoms like pain and fatigue. Unfortunately, many patients do not receive enough psychological support. Only about 10% are referred for mental health care. Providing compassionate psychological help early on can make a big difference in how patients cope with their journey through lung cancer treatment. In the end, the emotional difficulty of lung cancer surgery reflects how deeply a serious illness affects the human mind and spirit. Recognizing these feelings and offering support is a vital part of comprehensive care. Every patient's experience is unique, and personalized support can help them navigate this challenging time with strength and hope. Always remember to consult healthcare professionals for tailored advice and assistance.